What if I told you that almost every person who starts taking a medication like amlodipine is walking into a world of side effects they might never even expect? You've just been prescribed this drug, and in the back of your mind, there's a list, a massive list, sometimes nearly 100 potential side effects that could pop up. And if you're like most people, you probably Googled it, felt a spike of anxiety, and wondered, which ones will actually happen to me? Well, here's the thing. Not all side effects are created equal, and most of that online list is not what your doctor is really watching for. But before we dive into the 3 side effects that matter the most, let me take you behind the curtain on why that list even exists and why it might be more misleading than you think. Pharmaceutical companies, for legal and marketing reasons, have to report every side effect that has ever been mentioned by someone taking the drug. And here's the kicker. Sometimes those reports have nothing to do with the medication itself. Someone could have had a headache or a stomach ache after starting amlodipine, but was it because of the drug, or because they skipped lunch, stayed up late, or stressed at work? The lines blur. And that's why, as a physician, when I prescribe a medication, I'm not worried about every minor report online. I'm focused on the side effects that actually make sense based on how the drug works in your body. That's where things get interesting, because understanding how amlodipine works helps you predict which side effects are real and which ones are just noise. So, how does amlodipine work? Imagine all your blood vessels as hoses running throughout your body, delivering oxygen-rich blood to every organ, muscle, and tissue. Now, wrap each hose with a rubber band. When the rubber bands tighten, the blood pressure rises because the flow is restricted. When the rubber bands loosen, the blood vessels dilate and blood pressure drops. Simple enough, right? Heighten, loosen, optimize. But like anything in biology, it's never that simple. Loosening those rubber bands can have consequences because the blood doesn't just flow like a faucet. It has to navigate gravity, muscles, and the veins that bring it back to the heart. And that's where the first side effect comes in, the one that almost everyone taking amlodipine should know about, even before they take their first pill. Here's what happens. When the veins in your legs, which are also wrapped in those rubber bands, dilate too much, fluid can leak into spaces where it shouldn't be. You might not notice it immediately, but over a few days or weeks, you could see your ankles, feet, or even lower legs begin to swell. This is called peripheral edema, and it's by far the most common side effect we see with amlodipine. Now, you might be thinking, is this dangerous? Not usually, but it's uncomfortable, it's visible, and it can make shoes suddenly feel tight. And here's the part that most people don't realize. There are ways to manage it, ways that don't necessarily involve stopping the medication entirely. If your blood pressure is still high while taking amlodipine, one option is to add a second medication that offsets the fluid buildup, often a diuretic or water pill. It sounds simple, but this method requires careful monitoring because now we're balancing multiple medications and their combined effects. Another option, which is surprisingly effective, involves something as low-tech as compression stockings. These socks aren't just for the elderly, they literally help push fluid back toward your heart, reducing swelling in your legs. And finally, if neither of these solutions work, we can discontinue amlodipine and try a different blood pressure medication altogether. But that's a choice that comes with its own risks and trade-off. Every step in this process is about balancing blood pressure control with comfort and safety. And it's not as simple as just take a pill and forget about it. Now, here's something most people don't connect. The very mechanism that makes amlodipine effective loosening blood vessels also leads to the second major side effect. When your vessels dilate, more warm blood rushes through them. Think of turning on a garden hose to full blast. The water hits every surface it touches. In your body, this surge of blood flow can make you feel flushed or warmer than usual. Your face might redden, your ears might feel hot, and suddenly standing in a cool room feels like a sauna. It's not dangerous, but it's noticeable, and it can be startling if you weren't expecting it. The connection between blood vessel dilation and facial warmth is one of those aha moments that helps patients understand why a medication behaves the way it does and why your doctor isn't concerned unless it's extreme or persistent. But wait, Because here's where it gets tricky. These first two side effects, swelling and flushing, are directly tied to the medication's mechanism. They make sense. Yet there's a third side effect, subtler but potentially more impactful, that can sneak up on patients. This one isn't about swelling or heat. It's about your body overshooting its goal. When amlodipine works too well, or when combined with other blood pressure medications, your blood pressure can drop more than intended. And when that happens, you might feel dizzy, lightheaded, or unsteady, especially when standing up quickly from a lying or seated position. It's called orthostatic hypotension, and it's a classic risk whenever we lower blood pressure, but it's particularly noticeable in patients who start multiple medications at once or who aren't used to having lower blood pressure. It's the kind of side effect that can make you question whether the medication is helping or hurting, and it's why doctors stress monitoring and adjusting dosages carefully. Think about it. Every single effect, from fluid retention to flushing to dizziness, is connected. They're all consequences of loosening those blood vessel rubber bands. But not all patients experience all three, and the severity varies wildly. Some people might notice a bit of warmth in their cheeks, while others might end up with shoes that no longer fit because of swelling. Some might get dizzy for a few days as their body adjusts, while others never experience a single symptom. And this variability is exactly what makes prescribing blood pressure medication as much an art as it is a science. You can't just hand someone a pill and expect a uniform response. The body has too many moving parts, and amlodipine affects each one in slightly different ways. Now, I haven't even told you about the timing of these side effects, and that's where most patients get confused. Some effects, like flushing, can show up almost immediately after taking the first dose, catching people off guard. Swelling, on the other hand, often develops gradually, creeping up over days or weeks until you notice that your ankles look puffier than they did last week. And dizziness, that tends to hit during changes in posture, so it might only appear in very specific moments, standing up too fast from the couch or stepping out of bed in the morning. Understanding when to expect side effects is just as important as knowing which ones are possible, because it tells you what's normal, what's temporary, and what might require medical attention. Here's another twist that surprises many patients. Even though amlodipine is extremely common and we've been prescribing it for decades, the perception of risk often outweighs the reality. People read the online lists and panic about symptoms that are extremely rare or unrelated. Meanwhile, they might ignore subtle signals that are meaningful, like slight leg swelling or occasional lightheadedness, because they think it can't be the drug, right? That disconnect between expectation and reality can actually make side effects feel worse. Psychological factors matter, and the mind-body connection is real. So paying attention, tracking changes, and communicating with your doctor isn't just recommended, it's essential. And here's a piece of insight that most patients never hear. The side effects of amlodipine are predictable if you understand its pharmacology. Swelling, a logical result of vasodilation in the veins. Flushing, blood rushing to previously constricted areas. Dizziness, too much blood pressure reduction too quickly. That predictability is why, as a physician, I can tell a patient not just what might happen, but why it happens, and how we can intervene before it becomes a problem. The better you understand the why, the less intimidating these effects become, and the more control you have over your treatment. But there's one final angle to consider, one that patients rarely think about until it happens: interaction with other medications and lifestyle factors. Amlodipine doesn't work in isolation. If you're taking other blood pressure drugs, certain supplements, or even high sodium foods, the effects can compound or counteract the side effects we've been discussing. That's why monitoring blood pressure at home, staying hydrated, and keeping a symptom diary can be game changers. It's a proactive approach that turns the unknown into something you can manage. And trust me, once you see patterns in your body's responses, the mystery of side effects becomes far less frightening. By now, you're starting to see a pattern. Each of these side effects isn't random. They're not a giant, unpredictable list that will overwhelm you. They're connected, predictable, and manageable if you know what to look for. But here's the thing. Even with all this knowledge, patients often encounter surprises, and those are insider tips that most doctors don't get time to explain, and yet they make all the difference in your experience with the drug. So if you've ever wondered whether the side effects you read online are real, if you're curious about why your ankles swell or why your face feels hot after taking your medication, or if you've been secretly worried about standing up too quickly and feeling lightheaded, you're about to get answers. And by the end of this next segment, you'll understand not only the what and the why, but also the how of managing these side effects so that you can take amlodipine confidently, safely, and without constant fear. Because here's the truth. Knowledge is power, but applied knowledge is freedom. And understanding the 3 most important side effects of amlodipine and knowing how to handle them can transform a medication from a source of anxiety into a tool for better health. But there's one more twist you're going to want to hear, one that most patients never anticipate, and it can completely change how you approach your daily routine while on this medication. And we'll get into that next, Teber. Now let's get into the part that actually matters for your daily life. How to handle these side effects before they become a problem. Imagine waking up one morning and your ankles feel heavier than usual, your face feels flushed, and as you swing your legs off the bed, a dizzy spell hits. Panic sets in, but here's the thing. Most of this is entirely manageable, and understanding the underlying mechanism changes everything. Starting with peripheral edema, that fluid buildup in your legs. It's not random. Your veins have been loosened by the medication, and gravity is working against you. But the solutions are surprisingly simple once you know what to do. Compression stockings, for instance, are like giving your veins a helping hand, forcing the fluid back towards your heart. And if that's not enough, your doctor can adjust your medication regimen or add a water pill that encourages your body to excrete the excess fluid. The key is monitoring early intervention and understanding that swelling isn't automatically dangerous. It's just a signal that your body is reacting to the medication. But peripheral edema isn't the only trick up amlodipine's sleeve. Flushing the sudden warmth or redness in your face can be alarming, especially if it happens during a meeting or a social event. The moment your blood vessels dilate, blood rushes to areas that normally get less circulation and your body responds with heat. You might think it's anxiety, or even a sign that something is seriously wrong. But in reality, it's your body adjusting to improved blood flow. There are ways to mitigate this too. Staying hydrated, avoiding extreme heat, and even timing your dose for the evening rather than the morning can make the difference between a mild inconvenience and a noticeable discomfort. And here's a secret most people don't realize. Your body often adapts over the first few weeks. The flushing tends to decrease as your vessels get used to the medication, so patience and awareness are crucial. Then there's dizziness, the subtle but sneaky side effect that can catch anyone off guard. This isn't just a random feeling, it's the result of your blood pressure dipping a bit too low, especially when standing up quickly. You might brush it off at first, thinking, I just got up too fast. But repeated episodes can increase your risk of falls or injuries. The solution? Simple lifestyle adjustments, like rising slowly, staying hydrated, and monitoring your blood pressure at home. In some cases, your doctor may adjust your dosage or recommend splitting the dose throughout the day to keep your blood pressure stable. The goal isn't to avoid the medication, it's to use it safely, maximizing benefits while minimizing risks. And the better you understand the connection between cause and effect, the less intimidating these symptoms become. Now, let's talk about a scenario that surprises many patients, combining amlodipine with other medications. Blood pressure drugs don't exist in isolation, and interactions can amplify side effects. Take diuretics, ACE inhibitors, or even over-the-counter supplements. They can either exaggerate swelling, increase dizziness, or reduce flushing, creating a confusing mix of signals. That's why communication with your doctor is non-negotiable. Every symptom you track, every swelling episode, every flush, every dizzy spell paints a picture that allows your physician to fine-tune your treatment. It's like adjusting the strings on a musical instrument. Small tweaks can transform an off-key melody into harmony. Ignoring these details doesn't just reduce comfort, It can impact safety and long-term health outcomes. And here's a perspective most patients never hear. Understanding these side effects empowers you, but not in the obvious way. It's not just about knowing that your ankles might swell. It's about anticipating, observing, and responding intelligently. If you notice swelling in the morning, you can elevate your legs. If your face starts to feel flushed before a big presentation, you can plan for a cool environment or hydration. If dizziness strikes, you can pause, adjust, and prevent accident. Each side effect becomes a signal rather than a scare tactic, a conversation starter with your doctor rather than a source of panic. And the more attuned you become to your body's responses, the more confident you feel in taking control of your health. Let's pause and consider this. The 3 side effects we've discussed, swelling, flushing, dizziness, aren't random or mysterious. They are direct consequences of how amlodipine interacts with your vascular system. That's why predicting who will experience what and when is possible. But there's one last layer to this story that most people miss: the subtle, cumulative effects over weeks or months. A small amount of swelling that starts unnoticed can gradually worsen. Occasional flushing can impact sleep or social confidence. Minor dizziness, if ignored, can lead to cautious movement, reduced activity, and even secondary health issues. These aren't dramatic, life-threatening problems, but they matter because they affect quality of life, and managing them proactively prevents them from becoming disruptive. Here's the truth. When we talk about side effects, most people think danger, but what physicians see is signal. Every swelling episode, every flush, every dizzy spell is information. And when you know how to interpret that information, you gain control over your treatment in ways most patients never imagine. You're no longer just reacting, you're anticipating, adjusting, and optimizing your health while benefiting from the medication. And that shift in perspective transforms fear into confidence and confusion into clarity. Now, imagine the difference between 2 patients. One takes amlodipine without understanding its side effects, and the other takes it knowing exactly what to expect and how to respond. The first patient panics at every minor swelling or flush. The second patient notices the same symptoms but knows they're manageable, takes proactive steps, and maintains normal daily activities without stress. That's the power of knowledge combined with strategy, and it's exactly what we're building toward in this video. Finally, there's one subtle insight that rarely gets discussed. Lifestyle and monitoring amplify your safety and comfort. Simple things like tracking your blood pressure at home, keeping a symptom journal, staying hydrated, exercising moderately, and avoiding abrupt positional changes all work synergistically with your medication. They don't just reduce side effects, they give you a sense of control. And that sense of control, over time, can dramatically improve adherence, outcomes, and even peace of mind. Because let's face it, taking a pill is easy. Living confidently while taking it is the real challenge. And that brings us to the core takeaway. Amlodipine's side effects are predictable, manageable, and directly tied to its mechanism of action. Peripheral edema, flushing, and dizziness aren't mysteries. They're your body's signals that the medication is working and that your system is adapting. By understanding these signals, responding proactively, and maintaining open communication with your doctor, you can take amlodipine safely and confidently. No more guessing, no more fear, no more being overwhelmed by online lists that don't tell the full story. So the next time you take your dose, notice your body. Track the signals. Take action early. Use compression stockings if swelling starts to creep in. Drink water and plan for a cool environment if your face flushes. Rise slowly to prevent dizziness. These small, deliberate actions can transform your experience with amlodipine from stressful to manageable. And the best part, you're no longer a passive patient, you're an informed, active participant in your own health. Because here's the final twist that most patients never realize. Understanding, preparation, and proactive action don't just reduce side effects. They enhance the effectiveness of the medication itself. Your body adapts more smoothly, your treatment is more predictable, and your quality of life improves dramatically. And that's exactly why knowing the top 3 side effects and how to handle them changes everything. It's not fear, it's empowerment. And once you see it that way, taking amlodipine stops being a source of anxiety and starts being a tool